Good evening, everyone, and thank you for joining us tonight. Before we get started with the program, I would like to read this brief disclaimer that you see on your screen. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. With all that out of the way, I would like to say welcome again to the program. My name is Craig Orpello, and I will be your host tonight. And what is this? What are you here for right now? Well, this is the PharmAssist Virtual Learning Experience Program. It's an educational fertility program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own homes. You don't even have to leave. Thanks for joining us tonight. You are able to ask some questions with your provider. And so it takes place every Monday night at 7 p.m., where we are right now. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. So that's where you come in. And how do you get a chance to ask questions? Well, you're joining us either via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing any questions that you have in either format. So you can either jump into the chat or you can put it right into the Q&A section if you're joining us via Zoom. So, as I mentioned, we are joined by various amazing HCPs each week from across the nation to provide you with some real-world experience, just as if you were sitting across the table from them in the clinic. And so tonight, we are joined once again by Wanda Hofgesang. Thank you so much, Wanda, for joining us. Thank you, everybody at home, for your time and interest. And I now want to turn it over to Wanda to kick off the program tonight.
Thanks, Craig, and thanks for having me back on Monday night here for the virtual learning experience. As Craig said in his introduction, my name is Wanda Hofgesang. I am a registered nurse who has over 25 plus years experience in the reproductive endocrinology field, fertility. I do work in a Northern New Jersey fertility clinic, so I'd like to welcome you all. What the goal here is for this evening is, as Craig stated, we are going to have 3 medications that we are going to review. The 3 medications by name are going to be the Gonalef Rediject Pen, the Gonalef Multidose, and the Avadrel injection. So those are our 3 medications this evening. And so what we want you to know is we'll show a video of each of those medications with some instructions on how to mix the product, how to work with the pen, how to inject the medication, where to inject. And then after we take care of that, we will come back live with a Q&A session where you can ask us any questions, and you want to try to keep it product specific. Anything that might get into personal, your dosage or your timing of your medications, we want to let you know that, we will refer you back to your clinic for that. Just because we don't want to interfere with any instructions, we want to keep it really related to the product and nice and simplified for you so that you can feel like you're a pro in getting ready when you have to use these injections, whether it be tonight that you're starting or you might be starting very soon. So it's great to have you here. One thing I also want to mention about that is that all videos are also on the My Mandel's Pharmacy PharmAssist video library. So at any time after tonight, if you want to watch this video again for the different medications, or if there's any other medications that you're wondering that are part of your cycle that might be coming up and you want to take a look at them in advance, take a peek on that video library. That's a great tool for you to have access to that to help making your journey with your medications a much more comfortable experience. First thing I'll mention before we get into the first of our Gonalef video is to let you know that one of the things I think that is helpful is to open your box when you get your medications, that when they're sent to you, there's a lot of different medications in there. And I think it's always nice to basically put like items together, because you might have multiple medications, but you might have more than one of a particular drug. And it's just kind of nice to feel organized. I think that helps to de-stress us all when we do something like that, put things into an organized way, have a space in your home where you're going to put everything. The storage of each of these medications, what you're going to find is oftentimes from the pharmacy, there will be notations maybe of how to store something, but I want to also let you know that it is also on the product packaging. So if you ever have a question, just take a peek, because then it'll tell you if something might need to be room temperature, refrigerated, but we might talk about that later with some question and answers as well when we get to that. So big thing I would just say prior to getting started is if you haven't opened your box yet and this is your first night, tonight's a great night to do that. Or if you've received everything and you're not starting right away, definitely just open that box and take a look at everything when you can and get it sort of organized. So what we'll do is we'll have Craig put on our first of our videos, which is going to be the Gonalef ReadyJect pen. This medication video is to show you how to prepare and inject the Gonalef ReadyJect pen. First thing to let you know is if you are being prescribed the Gonalef pen, mainly you're using that to help stimulate follicles or eggs, multiple follicles and eggs, to grow throughout your cycle. So Gonalef is a stimulation medication, and it contains the hormone of FSH, which is follicle stimulating hormone. So that's the big one that's responsible, whether you're doing an insemination cycle or an IVF cycle. It's helping your body recruit and develop multiple eggs. Once again, I always like to ask or mention first, the supplies that are needed for the Gonalef pen is one Gonalef ReadyJect pen and one small needle tip that's provided for you with your pen. Your pen will come in a box, a kit of its own, and the needle tips and the pen will be in there as well. Couple little reminders about this medication is this medication is, again, a subcutaneous injection, like some of the different medications for fertility. So it's administered in either the lower belly or the upper top outer thigh area. That's routinely where, I know for me, our clinic, that's where we have our patients injecting. So you always want to follow your clinic and your nurse's instructions, but routinely that medication is administered in that lower belly and those upper outer side thigh area. So that's a subcutaneous shot. It's a little tiny needle. So again, you have an option where you could self-inject this medication or someone could administer it to you. There's no right or wrong. It's whatever works for you that helps you get through your cycle. So don't feel badly if you hear somebody else saying they give their own shots and you're not comfortable. We want you to always be comfortable with what you're doing in your cycle, and for everybody that's different. So whether you'd like to self-inject or have somebody give you your shot, whatever it takes to help you through the process is most important. With your Gonalef pen, it may come from the pharmacy and it may suggest to keep it in the refrigerator. Based on the manufacturer's description with this in terms of keeping it refrigerated, if you keep it refrigerated, it's good until the expiration date. If you keep it outside of the refrigerator, it's good for the expiration date or 3 months, whichever comes first. So either or is fine. Oftentimes we just tell patients to put it in the refrigerator because then that gives you the whole time frame and you don't have to worry about calculating. It's just good until that expiration date. Can I take it out of the fridge before injecting? And the answer to that is absolutely. You can put it on the counter for approximately 15 minutes or so. It just brings it up a little bit from that refrigerator temperature and makes it a little bit easier, a little less feeling that you might notice when you inject that liquid. Typically, this medication will not sting, but you'll feel a little pinch with the needle. And sometimes if that fluid's cool, you might feel that too. So certainly you can put it out on the counter and let it warm up a little bit before you inject. So for your supplies, we have the Gonalef pen. The first thing we do with that is we uncap this pen. And the next step is, it is sterile, guys, under there after the first time you use it, but it's just the nurse in me always has the habit of whenever I'm poking a needle into a surface, I clean that surface. So I'm cleaning the surface because I'm going to poke a needle in here. And the needle that I'm going to poke in comes with this product. It is a little needle tip. You just remove the little seal and then gently attach it. Don't over tighten because you are going to have to take that needle back off when you're done. So you don't want to over tighten too hard. So you just want to tighten it a little bit. And then next step is going to be to follow your clinic's instructions with your dosage. In here, what you will see is there is a little dial and there are some numbers. There, right now it's on 0. What you would do is you would turn to whatever dosage your clinic tells you. So I'm just going to turn this, and by the way, this dial can turn in either direction. So I'm going to turn this dial and I'm just going to simply set it to a dose of 150. So you might be able to see that in there, that it's a dose of 150. Again, that'll be determined by your clinic. The other thing I'll mention with this just quickly is a lot of times patients say, when will I know if it's empty? When you give a dosage after you inject, the dial goes to 0. When that dial goes to 0, that means that you still have medicine in that pen. So put it in the fridge and use it for your next injection. The goal of this pen nicely is that it's already mixed and it's multi-dosed, and you're going to use it up until you're done. Eventually what may happen is when you turn your dial to your dose and you give an injection, if there is ever a number that is not a 0 in that window after giving the shot, that's letting you know, hey, I couldn't give you that injection because I'm now empty. So you would discard this pen, open up and get a new pen with a new needle, and turn the dial to whatever dose this one stopped at after you finished your injection. So if it stopped at a dosage of 50, then you would open a new pen and give just a 50 unit dosage. The other thing I wanted to mention is that the pen is multi-dose. The needles are one-time use. You always only put a needle on, give an injection, and discard that needle into your sharps container that will be given and provided to you by the pharmacy. So the pen itself is multi-use, but not needles. Needles are one-time use, and then you discard, okay? For injection technique for this one, like I said, just to show you that, it will go in either the belly or the upper thigh. So just to get our little mannequin here, in the upper belly, lower belly area, not upper belly because we have some muscle up there, and in our upper thigh, outer thigh area because we have some fatty tissue. So we want to avoid muscle. This is a fatty tissue shot. So if I were giving this mannequin an injection in her belly, I would have her possibly lay down like this, and I would administer the needle to go straight in 90 degree this way, straight in 90 degree this way, or if I'm giving it in the side thigh, it's 90 degree this way. So that would be if she were laying down and I were administering. If she's self-administering and she's standing or sitting, she would be in this position. So what we would want to do to get ready is the first thing is uncap your pen with the big cap and save it, but turn it so that the part that's open is facing up on the counter. And then you'll see that there is a green color here on the tip. We get rid of that one. Don't try to put that back on. I've watched patients do that and they actually stab themselves, and I don't want you to do that. So that one goes in regular trash. Save the other one. And then what you're going to do is you have to clean that area of the belly so that it's good and clean for this injection. And just a little key with your shots, guys, and I'll show this with my arm, is when you're pinching the skin for a fatty shot, you want to give a gentle lift. If you squeeze really hard, you're going to bruise. So sometimes when patients come to me with bruising, I actually have them lift gently so that make sure that they're not squeezing so hard. It's just we're kind of nervous, so we squeeze a little harder, and then that can cause trauma to the skin. So it's this one, it's a gentle little squeeze. Again, we do not have to jab this needle. Just place it to the skin, give a little push. That needle goes all the way in. Once that needle's in, then you are going to push on the end of this pen and push all the way until you feel almost the pressure that you can't push anymore. And once you feel that, count to 1, 2, 3 and let go. Then remove the needle in the same angle that it went in, set it down, and put a little cotton ball to that area. Wipe it if you need to. Usually you do not need to Band-Aid these areas because literally the bleeding stops very quickly, and you'll be able to touch the area after you've given the shot because you won't have felt anything other than the pinch of the needle, which is like a mosquito bite, and usually you will not feel the medication going in. Now what I do is I take a look at that dial, and I do have a 0 in my window there. So that tells me that this pen has more medication. So what I'm going to do is I take the cap and I put that needle into that cap and I give it a little pinch and I twist that dirty needle off that I used. I discard it into a sharps container that I will have from the pharmacy, and I reattach the pen cap, and the pen goes back into that refrigerator for your next use. So keep in mind, this medication is subcutaneous, meaning it's a little fatty shot in those thigh or belly. It contains FSH, which is the follicle stimulating hormone, which helps your body recruit and develop those multiple eggs, whether it be that you're doing this for insemination or for IVF. Hope this helped you with your Gonal-f, and best of luck with that medication. So hopefully that was a video that helped you see how it is that Gonal-f pen works. As you can see, with something that's in a pen, it's nice and compact, and you're not with that product necessarily mixing. There are some fertility medicines that are mixing, which aren't too bad either, even though you have to do a little mixing. But this is one that is not a mixing product. The emphasis, I would say, is that it's subcutaneous, which is meaning that it's a tiny needle, little tiny injection. Think insulin when the days before pumps. And also know that it has a window of time that you take it. It is not for a long haul. And so we'll talk about that if there's any questions on that. But the idea is that there's a beginning and an end to taking that medication of the Gonal-f. And it's a product that typically is in the beginning of the cycle, any cycle that you might be in for insemination or IVF. It's at the beginning because it's helping in the recruitment or the follicular phase of your cycle. So Craig, if we have any questions that we can help answer, we will.
Yes, absolutely. Thank you very much. So we do have a bunch of questions coming in so far. And the first one that I wanted to go to is, it's a little bit kind of like high level here. And we've answered this before, but the question is, how exactly does FSH work? What impact is it having on my cycle treatment?
So FSH is normally a hormone that we have as women in our natural cycles. And that FSH is, as I stated in the video, called follicle stimulating hormone. So that helps to communicate to those ovaries and allow those ovaries to respond. And you'll have follicles that are normally there waiting for that hormone to communicate to the ovaries. So what it'll do is it'll allow for both of your ovaries. Sometimes you'll have one ovary that might respond more than the other. That's not an issue. Or if you only have one ovary, that ovary can respond. And what it does is it helps recruit the follicles that might be there waiting to be stimulated. And once they're exposed to that medication, it allows for those follicles to grow over a period of approximately 7 to 10 days. It can sometimes take a little more than 10 days, which is fine, but that's the average time it might take to help your body recruit from using the Gonal-f pen. And these follicles grow over that period of time, and that's when your center might be seeing you for ultrasounds to measure the growth of the follicles over that period of time in order to get the proper timing, if you will, of your procedures such as insemination or IVF egg retrieval.
Perfect. Thank you very much. And just the perfect time to say, as you had mentioned earlier, the way we try to do this is that you can ask questions that are specific exactly to the delivery device, or you can ask about the kind of bigger questions about the product itself, as that last question was. And we will try to answer everything we possibly can. There will be obviously some questions that may be easier for us to direct back and say, that's a great question to ask at your clinic. But anything up to that point that we can answer, any way we can help, that's the point of this program, is to really drive home to make you feel comfortable, get all your questions out now so you don't have to worry about them later when you're ready to give your shot. So speaking of the shot, we have a question here that came in, and I know this is one that you talked a little bit about how the pen works and how you can dial it up and back. And so the question comes in, I know I can dial back if I have gone too far, but what if I accidentally inject too much? Is it dangerous? How should I handle that shot? And then how should I handle the next one coming up?
That's a good question, and that certainly has come up for us in our clinic as well at times. What I always say about that with patients is, don't hide behind what you perceive as a mistake or an error and think you're going to, as we are when we're growing up, we're going to get in trouble. Don't want you to feel that way. Transparency is the key with your clinic, and open communication is the key. So what I would want you to know is, if you feel you may have dialed up to a higher dose than what was prescribed, just always give a call at your clinic and talk to your nurse and doctor team. They might make some adjustments. We've done that, and we might make some adjustments in that future dosage, or we might not need to make any adjustments. They might bring you in to be monitored sooner. Say you weren't expecting to come in tomorrow, and maybe you were coming in on Wednesday, in the case of this evening, and say that the clinic might say, hey, well, we'll see you back tomorrow just to check in on things. So what I want you to know is don't ever worry that you're doing something, perceiving that you're going to get in trouble over any dosage, what you perceive as an error. We can usually work with this, and we want to remain flexible with that. As long as we know what's going on, then we can address it. So communication, open communication is the key in talking to your nurse and your team.
Perfect. Yeah, and I think that's actually a perfect time to say that communication throughout this entire process, that's actually probably going to be the answer for a lot of these questions. Is you always reach out and talk to your clinic. They can help you through these situations if you have questions. There's very few situations that anyone could ask a question about that you haven't seen before or that your clinic hasn't seen before. And the same thing applies to wherever your clinic is that you're going. Your nurses have seen it before. So be very comfortable knowing that you can pick up the phone and call when you have questions like this, and they'll be able to walk you through it. So thank you very much for that. We appreciate it, Wanda. And then this one is it's a little bit more, I guess, in the delivery device as opposed to the medication itself. But the question is just what benefits, if any, does the Gonal-f pen have versus the vial?
So we are going to show in the next video is going to be something called Gonal-f multidose, and it's a vial. It's also multidose like the pen. So they're very similar in the shot technique. They are exactly the same in having the same FSH component. They are injected in the same area. They're just, the delivery system is what looks different. And what I would say to that is just sometimes things evolve and change over time, especially with the manufacturer, but it doesn't take away or detract from the efficacy or the impact of the drug. So what I would want you to know is sometimes your clinic might choose to use a certain Gonal-f for you. Sometimes your insurance company might have a preferred product that is in network, and we want you to get the full benefit of your coverage. So basically just to know that there can be, again, it's almost like being flexible again. We can be flexible, and where we can be flexible is sometimes we have different delivery systems, but doesn't mean that one is better, one is not as beneficial. That's, I think, the key that I would want to recommend to everybody.
Perfect. Yes, and I think too, just one thing to add, like you mentioned, the flexibility. There's a lot of options out there, and part of what our responsibility as well on the pharmacy end of things is to make sure that we present you with those different options and try to help you figure out the one that makes the most sense for you. Obviously, medication-wise, things come in, and that decision is being made at the clinic level. But we want to make sure that we can help you when it comes to your insurance and figure out. We actually work hand in hand with your clinic to find out what insurance might require and where you have some flexibility. So it might have just been an option that was written down more as a way to say, okay, let's get the ball started. We want to get this, get this product through, but let's see what the insurance requires, one versus the other, or something like that. And so I think that's a great thing to know, that we work very closely with the clinic, and your physician, your nurse, the pharmacy, and the patient. It's all kind of the partnership between the three of us to make sure that you get the best quality treatment that you possibly can. So perfect, great question, and excellent answer, Wanda. Thank you very much. And now we're getting into the stuff that I was expecting. We always get these, and these come into a little bit more digging into the specifics of how's this shot going to work for me. And we see this question, you've answered it probably almost every single one you've done, Wanda, so far. But what common side effects can I expect with FSH in general, and how can I treat them or plan to prevent them if possible?
Well, I would first say that is something that usually you want to address with your clinic, to go over, the symptoms or side effects. But what I will say, as my perspective on it, in terms of being a nurse in this field for a long time and having to counsel patients, so I'm certainly coming from my professional experience. But in general, with FSH, what you're going to find is that what it's doing is creating multiple follicles, and it's enlarging the ovary a little bit in that process. Usually at every clinic, they're going to look to keep you on the lowest dose possible for a maximum effect. In other words, they're going to take into account your age, your diagnosis, and your history. So you always want to give what will work best with each patient. And each of our patients are always individuals in their age and their diagnosis and their history. So you will be treated differently, and you should be, because you should be treated as an individual within your practice with that aspect. In terms of just general though, FSH is, like I said, enlarging the ovary a little bit. It's creating multiple follicles. So in our pelvic region, we have our fallopian tubes, our uterus, part of our bowel, and these ovaries when they enlarge a little bit. So sometimes you could just feel a little bit more fullness in that area. You could feel a little crampy. You could actually potentially have frequency of urination sometimes because those ovaries, and if you drink a lot of water, which is a great thing in your cycles, it can push a little bit on the bladder to have you go more frequently urinating. So just in general, what I would say is touch base with your clinic, but know that you could get a little crampy feeling, a little fullness feeling, or what we could sometimes term as bloating. Usually what we would suggest is helping with bloating is drinking lots of good fluids. In terms of the cramping, your clinic would advise you if there's any pain reliever of choice. Sometimes it's Tylenol that they might say that is appropriate that you could take. And just knowing that you're going to feel some of that off and on, and it's not of a concern. Pelvic pain would never be what we want you to experience. So if anybody ever has that, your clinic would certainly advise you to call them with that, but know that that's not something that you should experience.
Perfect. Sounds good. And thank you again. I know sometimes they're the, people are trying to get ahead of that and you want to be prepared. And a lot of times this is a great place to ask that question, because you can find out, kind of get preparation up front of what may happen, what could happen, and what you don't want happening, so that you're prepared. So when you're ready to give that injection, you're not having any of those last minute jitters. So glad that we can get those questions answered today. So thank you very much. And with that being said, it seems like as of right now, Wanda, we have answered all the questions that have come in so far. So as we always do, I want to remind everyone, it's not a race to get your questions in. So if you think of questions later on about the GonaLeft pen and you want to come back and ask them, you can ask them throughout the program. And what we will do now, though, is let's give another 30 seconds or so. I'll throw it back over to you, Wanda, as we give people, if they're furiously trying to type in that last second question, and then we'll get ready to move on to the next product.
Okie doke. So take a look at any questions you might have, but just to give you a heads up then what our next product is. Our next product is another GonaLeft product. It's multi-dose vial GonaLeft. And as I mentioned, it is similar to the GonaLeft pen. It is multi-dose. It is subcutaneous, which means that it goes in the belly or the upper outer thigh area. And it's also an FSH product, the follicle stimulating hormone product. So that multi-dose is something that you're going to see may have been prescribed for you, and we want you to be able to see how that would work. And we will be going on to that video next with Craig's help. And then any questions that you have about that one, we will take them after the video is done. This video is to help you with the multi-dose GonaLeft with mixing and administration. If you've been prescribed multi-dose GonaLeft, GonaLeft is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue. So that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is 1 vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that 1 vial. Know that that's the medication, is that 1 vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is 1 pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have 1 Gonalef, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than 1 day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is, finishing it off is this injection syringe, which is a Gonalef 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click. And then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe, because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. it may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container. But let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen. So don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150. Which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air, because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go, okay. Insert that right into the center, and then turn it upside down, and then you inject a little bit of air in there. That helps to sort of equalize things a little bit. And it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing. But then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and the nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that you are going to give the injection. It's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's a-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject, though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2 inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it's occasionally happens to people when they get blood drawn or shots given. It's a-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab, okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there, and with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel, and I actually really didn't feel anything, and I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently, set it down, and then you'll put a little pressure there, just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using the several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using 2 separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it still doesn't have to be 2 shots. It can still be just that one injection. But when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150. Okay. So I hope that video helps you to understand the multi-dose Gonalef product, and best of luck with you in getting started on your injection journey. So as you can see, the multi-dose Gonalef is a little different in terms of having to mix it, which the Gonalef pen is not a mixing drug. But they are very similar in a lot of other ways, as you saw, in terms of the injection technique, where they go, and in terms of having to mix once and then you're just drawing up for several injections, which is nice. It's the mixing is a one time for that vial, and then you use it till it's empty. So there's not a lot of mixing, but it's just a little bit different than that Gonalef pen. So if we have any questions regarding the Gonalef multi-dose, Craig, can let me know.
Yes, actually. So this question came in, I think it came in anonymous. So I'm not sure if it's the same person, but it came in obviously based on the question that came in earlier. So it says, you answered this before for the pen, but can you name any pros or benefits of using the vial versus the pen? So just kind of some of the things maybe that we just talked about and that you went through that might be a reason why somebody would end up using the vial instead of the pen.
What I would say to that is that, as I mentioned, they are very similar in terms of a lot of issues with each of the products. What might be beneficial to you is sometimes, depending upon whether you don't have insurance coverage or if you have insurance coverage, it could be a preferred product for your insurance. So again, what's nice is that we can remain flexible as practices, and we use the pharmacy like Mandel's to do a little research on your insurance coverage, and they will always guide us as to what would be best to potentially dispense for you based on that coverage. So that sometimes is the benefit, is it might be a cost factor that could be beneficial to you depending upon insurance, no insurance, and any programs that each of these products might have at the time that allow you to save a little bit of money as well. But it doesn't compromise the efficacy of and the benefit of the drug.
Perfect. Thank you very much. And again, a lot of this stuff is going to be preference, and that's why options are great. But it's good to know some of the differences depending on whatever your physician ends up providing for you or your nurse chooses for you, just to know some of the benefits and the features of those different products. It's not necessarily pros versus cons. We're not always comparing against a different product, but you just want to know the features and benefits of the product that you're going to end up using, which is great. So especially one like this, which you will be taking, you'll be taking for over time. It's not just like it's a one-time only shot. So it's good to know.
Mm-hmm.
So thank you so much, Wanda. So this one comes in, it's a little bit, before we talked about what happens if I accidentally inject too much. This one's kind of the opposite of that. What happens if I end up missing a shot of my Gonalef? Do I have options, or is my whole cycle wasted? Will I have to start over?
That's a really great question. And I know I have answered that at times at our clinic with patients that may have fallen asleep early, had a rough long day, and they just fell asleep and didn't get to their injection that night. And certainly understandable. Sometimes I even mention to patients, and since we have our phones a lot of the time, set little timers, that sometimes works to sort of keep you on track. So that might just be like a little helpful hint prior to starting, is pick a time. If you get a little tired because you have a long day, you can talk to your clinic in terms of the timing of your medications. But sometimes maybe, not waiting till so late. So those are some things to try to, hedge against that happening. But if it does happen, once again, I'll refer back to being very communicative with your center, letting them know, because oftentimes your nurse and your doctor team will be able to handle that if you missed an injection, possibly making it up in a future injection, or maybe not. So there's ways to handle those types of what you perceive as an error and not feeling like I've wasted my whole cycle. We don't want you to feel that way, for sure.
Perfect. I think really, driving home the idea that it's just all about making sure that you are open with your clinic, and they're always going to tell you. I cannot say enough in all the questions that you've answered, Wanda, that any question that comes up or any like fear, issue, concern that you may have at home, you are certainly not the first person to have it happen to you. So it's always good to know that. It's good to know that you're in a group, a family of people who have all gone through similar situations and have probably made some of the same mistakes that you are fearing you might make, or you might potentially end up making. And so that allows everyone to have some experience to be able to walk you through what your options are on the table. So great. Again, get them out now so that you ask those questions today, and then hopefully tomorrow you don't forget your shot. You have now some things like your phone, or maybe your Alexa device. Sorry if I set somebody's off at home, but you can ask it to set a reminder for you to remind you when to give your shot. So just some options on the table. Hopefully we can help with. So that's great. So let's see. Another question here comes in. So how long will I need to be on Gonal-F throughout my entire upcoming cycle?
So as I mentioned, that everybody's age, diagnosis, and history goes into their dosage. But in terms of that, it's also what's going to drive how long it might take your body to respond. And again, you're gonna see, I'm gonna close this up tonight with a big talk about flexibility. Want to remain flexible in knowing that there is no set rigid standard. I threw out there at the beginning, I think of either the Gonal-F pen or multi-dose, that on average, it can take your body 7 to 10 days to recruit and develop the follicles using the FSH product. So that's an average. And it doesn't mean that you're something's wrong with you if it takes you 11 days. I would never want anybody to hone in on specifics. I would want you to remain flexible in knowing that it's going to take however long your body needs. But certainly we usually will see you should be ready for no more than possibly 2 weeks at most. But most often my experience has been that the average is between 7 to 12 days, give or take. So there you go. That just kind of gives you a time frame, and want you to know that, again, there's a lot of window there. So whatever your body needs, however long it takes your body, that's what you have to go with. And that's what we have to go with.
Great. Thank you very much. It's a great answer too, to remind people that a lot of times, unfortunately, you're going to get answers that aren't hard and fast, like this exact number or this day or at this time. It all depends really on you. And that's also the benefit to all of this treatment, is that it can be so customized to exactly what you and your body need to get through the process of the treatment cycle. So thank you very much, Wanda, for reminding us all of that. So that's great. Okay, so let's see. Any questions here? How about this one? What is the benefit of overfill as it pertains to my cycle?
Each of these products does actually have a little bit of overfill. And what I thought of when I saw myself in that video where I drew up and I said something like a little bit had squirted out. That's actually one of the things that's very helpful is, it's humans. We're human behind, even professionals. We're humans behind working with some of the medications, and you might have a little squirt out. That's one of the benefits of a little overfill in there, is that when it says you have a 900 unit pen or a 450 unit vial, it's sort of guaranteeing that amount because they've added a little bit extra. So you can feel reassured if they only added enough for that amount. Maybe then we'd be a little nervous that we're going to shortchange ourselves if we have a little accident and something squirts out. So that's the benefit to you of the overfill. The other thing is with the overfill, if you have a little bit extra, you want to use everything up. That's why you want to use the pen till it's empty and the vial till it's empty, because you may not have to open a new pen and use it, or purchase another pen because you may actually have enough in there. Or with the vial, you may have enough in that vial because you get everything, every little last drop out of there. So that's the benefits, is that you might not need to then go and get to the pharmacy and happen to get another vial or another pen. But certainly if you need it, it's there too. So I think the overfill is to benefit you so that you can use up everything you have, but also be guaranteed that the amount that they're saying that is in there when they dispense it is in there, because they've actually given you a little extra too, and you don't have to panic if you make that little accident or that little spill that you saw that I even did when I was in the video.
Great. Thank you very much. I know that's a common question. It does come up quite a bit, and sometimes people don't, quite grasp what it might be, or they don't understand. And so this is a great forum to really explain some of the different ways that the companies themselves, the pharmacy, and your nurse can educate you on ways to help save some money. So that's great. So thank you very much. Actually, perfect timing for this question came in. So speaking of saving money, how can I find out about different ways to save money, if at all possible, on my Gonal, and I guess on my products in general?
So that's a great question to ask. And some of those promotions or savings plans are definitely something that are real beneficial, that we use the pharmacy, like Mandel's, to educate even us. They are always communicating, collaborating with us to inform us of anything that they can help to keep the cost down for our mutual patients. So I would say that our pharmacies are our biggest asset in letting us know about the products and any benefit, and I mean, any programs that are out there that can be of benefit to you that you would be able to take advantage of. So definitely know that communicating with the pharmacy, and when they will contact you to review even your order, that we place the order, we send it to the pharmacy, and then what the pharmacy does is they're going to look at and touch base with you once they get some insurance information, and they will then review with you any programs that you might indeed be able to take full advantage of. So we really rely really heavily on pharmacies, Mandel's Pharmacy, to provide that to our patients, because we need the education even as a clinic, because we're busy with our clinical stuff, but the pharmacy piece is a part that we're all involved in.
Thank you for that little shout out there, Wanda. We appreciate it. And actually, yes, that is one of the big things at Mandel's that we always do, is we do provide, we have financial counselors, we walk you through the different opportunities and options out there. Our goal is to basically get you eligible for the lowest possible price that you can possibly pay. So there are different programs out there. And like Wanda was saying, there's programs for if you're in the military or compassionate care. There are different programs out there that are made to offer discount programs. And instead of making you do the heavy lifting and trying to find all that, we take it upon ourselves to make sure that we are up to date on all of that and that we ask all the right questions to get you those prices. So rest assured, knowing that when you come to Mandel's, our goal is to make sure that you pay the lowest price you possibly can, not $1 more. And we can walk you through the entire process to explain how that happens, and then show you how much money you saved, which is always a great thing. So
absolutely
great. And that's another partnership of us working together with the clinic to make sure that everything that can be out there where you can save some money, we're educating your nurse as well, so that, you know, if you're going to see Wanda, Wanda's aware of this stuff as well and can share with you all the different things that Mandel's can help you out with. So it's a great partnership to really help out throughout the process. So with that being said, we have come to the end of those questions that I see. I'm going to hop back over. I'll kick it back over to you, give another 30 seconds or so, and just hop into the room and see if there's any more questions in the chat. But otherwise, if I don't see any, we'll be ready to move on to the next product.
Okie doke. So actually, like we are going to go with our next video shortly. Craig will see if we have any other questions, but the Gonal F2 products that you saw, you can see some variations, but those are your FSH products. We're now going to turn a little bit to a different type of product, but actually very similar in the sense that it is also a subcutaneous injection. The next of our medications is going to be Ovidrel. And Ovidrel is a medication that is typically taken to induce the ovulation and prepare you for procedures such as an intrauterine insemination and or if you're doing end up ever doing an IVF egg retrieval. So Ovidrel has that action of ovulations. It's kind of nice because the name of the drug kind of can help you think about that, Ovidrel ovulation. So I kind of like that. It makes it easier to sort of remember. So know that it's different in what its action is, but it's actually very similar in what it is, how it's administered. It's a self-injected, or somebody can give you this medication, but you have the option. It's also going to be one that we use the belly and the thigh area. So that's very similar to what we've seen. And again, subcutaneous means that small needle. Okay. So I think if we're ready, I think, Craig, I don't think we have any more questions for the other products. So we can probably move on to our Ovidrel video. And then when we come back, if you have any questions, feel free to ask away and we will help you answer those questions. The first medication that we're going to review for your fertility cycle is Ovidrel. Ovidrel is a medication that is used for ovulation. It either prepares you for possibly an egg retrieval, or it prepares you for an intrauterine insemination. And it just depends on which center and clinic you're working with as to which medication they use to help with that ovulation. But Ovidrel, just first off, just so you know what you're going to need, my biggest thing with Ovidrel or any of the medications in teaching is just to tell you what supplies you need before you get started. So just a little sheet here is letting you know that the supplies you need for Ovidrel is 1 pre-filled syringe of Avadrel. It's nice and simple. That's only one item that you need. So to start out with this medication for ovulation is really easy for patients typically to use, and hopefully it'll be easy for you too. The nurse and me, the other part of this is very important that you know that doing a medication is not a sterile technique, but it is a clean technique. So once you get your box of Avadrel and you're preparing yourself to prepare for the injection, what I want you to know is just go and wash your hands first, or if you have a little bit of bacteriostatic hand sanitizer, what I want you to know is just either way, it's just good to start off with clean hands, okay? This medication, like I said, is for ovulation, but the other thing that I want you to know about it is that it is a subcutaneous injection, which means it just goes into the fatty tissue, which is good because that's a small needle, and usually those are easier to sometimes tolerate for patients because they're a little bit easier to administer, and literally the pinch you feel is like a mosquito bite. So to give you something that you've already done, possibly to make this seem not so daunting, is if you've had blood drawn, you have done something more evasive than this injection. Little injections are a little pinch. That's literally all they are in the skin. So first off, when you open up your box of Avadrel, what you're going to find in there is your syringe is going to be pre-filled, pre-dosed, ready to go. So as far as for patients go, this is one of the easier type of medications we could have you take for your fertility cycle because all you're doing is injecting. And we would always guide you at the center, your center, wherever you may be, with when you need to take it and what time, if there's any sort of time requirement for you with your center. So let me just open that. There we go. In the box is a syringe. You'll see it's pre-filled with liquid. That liquid is ready to inject. That's the medication. So simply, sometimes what you might see that people hear about is bubbles, and if you're worrying about any bubbles, you just give a little snap to the syringe and the air bubble rises to the top. I kind of I sometimes discourage sort of shooting liquid out because that is precious medicine to your cycle, so I don't want you to lose anything. So it's okay if you do a little bit of push with the syringe, but just be very, very careful if you do that. So I'm not going to uncap it yet because I want to show you where this injection goes. And with the help of my injection mannequin, what I want to show you is for this injection, typically you're going to use the lower abdomen, lower belly below the belly button. And when you take this, this is a one-time shot, so it can go anywhere in this belly. The other area to use are your upper thighs or outer thighs, because again, this is a fatty shot, so it just needs to get into that subcutaneous tissue. This injection can either be self-injected or you could have somebody give it to you. So what I'm going to do here is actually, if I were self-injecting and I was standing, and this is my body as the mannequin would be here, I just want you to see that the needle would go in at a 90-degree angle. The other part of this type of shot is that you pinch the skin just a little bit when you administer it because you want to make sure that you're getting into the fatty tissue. So first thing we do to that area is we clean it with alcohol. Just get a good little clean there. Next step we do is we can uncap the needle. Just be careful. Put that cap down. And here's where I said that if you did a gentle little push-up with the liquid, if it comes out, you can do that, but you want to gently push that up and create a little bubble, and that bubble or a little release of liquid, and that's fine. And then what we're going to do is we would pinch the skin in this belly, and we don't have to jab. Place the needle gently to the skin, insert the needle all the way, let go of the fatty pinch, push the medicine all the way in, count to 1, 2, 3, and then release and take out that syringe. And you can put a little cotton ball there. You might get a little bit of the fluid from the medication or possibly a little bit of bleeding that you could have as well, but that's fine. That's what you should notice. The bleeding would go away pretty quickly. So with this medication, what you want to know about the injection is it's very quick. It goes in quickly. It's a little pinch when it goes in. And Avadrel doesn't typically sting. Some medications can, and we'll talk about that if we have any. But just for this medication particularly, it's not usual that you'll find that it stings. Hopefully this has helped you. to see how to work with your Ovidrel medication, and I wish you the best of luck with your cycle. So as you can see, the Ovidrel injection, very similar to the other two medications that we showed tonight with the Gonal-F, be it that they are subcutaneous, little belly shots. So it's nice to kind of see that there's one technique that might cover several injections. And I think that's what makes this a little bit easier to grasp sometimes when you're doing multiple medications in a cycle, because one injection technique to know, and then just the different medications, you just have to tweak a little bit for each of these different medications. And you see that there's different delivery systems, pre-filled syringe in a vial to mix and a pen, but they're all kind of just have their own little needs that you have to take care of in preparing them, but then the rest of it sort of takes care of itself once you know that injection technique. So Ovidrel is a medication that is being taken to help ovulate or to release the follicles that have been developed prior to the stimulation with the Gonal-F type product. Craig, I don't know if we have any questions.
Yes, so we do. A couple came in. So this one is, you will enjoy this question because this is one that comes up pretty much every single time. And so you're a pro at this. And so this question asks, have you ever had a patient miss their shot time? Which we already mentioned, anything that somebody thinks is the first time and is not the first time, but that's a good question. And they follow up by saying, I don't plan to miss it, but how should we handle that if it does happen?
Good question, and it does happen. So again, we have kind of alluded a little bit to it with the other medications, and I think the emphasis that we've stated is communication to your center is key. If there is a medication or a dosage that you miss, it's always just important, or the time frame, I should say, if you were given a specific time frame, just letting everybody know. That's absolute key, because adjustments can be made. And if we can make those adjustments, if we as a clinic and as your team are aware. So awareness and communication helps us handle any perceived mistakes so that we can adjust.
Perfect. Thank you so much. And again, I think these are the things that really make people feel comfortable. Is again, we cannot reiterate enough that you will almost certainly not go through something for the first time ever. So glad that we can answer those questions now, so people really do feel comfortable. And hopefully bringing it up front will prevent you from having that situation where you actually miss it, because now you know that when your nurse gives you a specific time for a specific shot, there's probably a reason for that. So make sure you set reminders and make sure you're on time with that one if at all possible, but know that you have backup plans if you need them. Okay, so how about this one? Says, where I live, it's been very cold so far this winter. How do I store my Ovidrel safety, and how do I travel with it safely? I mean, how do I travel with it safely so that nothing happens to the medication?
With the Ovidrel medication, from what I can recall too, is the product information. First of all, when it's dispensed to you, it will come and it might say to refrigerate upon arrival. So even if it's a little colder where you're at, what I would want you to know is refrigeration can be a way to store the Ovidrel. So as long as it doesn't freeze. So, it is a water-based product, so sometimes you want to be careful because water can freeze. So certainly refrigeration, it sounds like if it's just been a little cold, that's fine, because when it comes to you, it's going to come and state oftentimes a little reminder to refrigerate. The other thing, though, that you can know is I do also believe it is that you can store it at room temperature. The only thing about storing it at room temperature, if you've kept it for that, is that it would be, I believe, good for about a month. So if you receive the product and you end up using it within 3 weeks, then that's great, because you've had it within 30 days and you kept it at room temperature. That's okay. It's just that usually it will come to you saying to refrigerate. So if you're traveling with it, sometimes some people, if it's a warmer time, they're going to put a little bag together with an ice pack, and you can put that in there to keep it cool, like as if you're traveling on a warm day. Sometimes if we get little power outages, guys, and you're afraid that your refrigerator goes out, I'm sure you have a place like my garage and my home tends to feel like my refrigerator a little bit, because it's cool in there. So you could probably leave it out in there and it would be fine. So that's the thing to think about, is you can get creative with this. Just know that it's okay either way, but it just means that you might be able to keep it for the expiration date if it's been refrigerated the whole time, versus it might only be if you've kept it at room temperature upon receiving it, that you just might have a shorter time frame before using the drug.
And yeah, that's actually perfect too, as a reminder back to what you had mentioned in the beginning, Wanda, about having patience. When you get your box, make sure you just open it up and go through it, take a look and see what's in there. Don't try to like treat it as something like, ooh, it's going to be a surprise. I'll save it to the last day and open it up. That's a bad move. Don't do that. Open it up right away. Treat it just like any other box of that super cool thing that you ordered for yourself as your little holiday gift on Amazon. You don't sit around and wait and get to it when you get to it. You open that thing right away. And that's how you should treat these packages, because there will be information in there about what you have and what needs to be kept in what way, where it needs to be stored. So the sooner you get into that, you can make sure that everything goes to the right place, and that you also know what's in your box so that you're prepared on what you're giving when, and so on and so forth. So it's just another little, kind of pro tip that we like to say is just open it up right away, go through everything, and then you'll know where to store things, how to store things, and just what's there so you're ready. You do not want to have a surprise the day of your first shot when you're getting ready and you're opening it up and trying to dig through and furiously figure out what's what and what goes where, and did I leave this out too long or whatever. So thanks for really driving that home, Wanda. We appreciate it. And so that brings us to this next question that says, what is the difference between Avidril and the other forms of HCG out there, such as Navaril? Is it possible to switch between the two different medications? Are they, functionally the same?
Good question. They are functionally the same. Actually, the action of that, both of the Navaril or the Avidril, they are used in your cycle to induce the final maturation, if you will, of the follicles, preparing the eggs for conception with, if you're doing, for example, an insemination with sperm cells, or in an IVF cycle that you might be using and you're fertilizing the eggs with sperm cells, or even if you're freezing those eggs. Absolutely, the Navaril and the Avidril are the medications that are right before those procedures, and it prepares them to fully mature and get ready for the next step. So some clinics use Avidril for their ovulation medication with that. Some clinics might use the Navaril. The big difference in them is presentation, not efficacy of what the drug is doing. I think that's the biggest thing, is it's not changing what's going to happen with your body and your cycle. It's just you might be using a different drug under a different name. And really with the two drugs just that you're just mentioning, is Avidril, as you saw, is a little tiny injection in a pre-filled syringe. The Navaril is a little bit like the multi-dose. It comes in a vial and you're putting a little bit of sterile liquid in there, letting the vial dissolve, and then drawing it up for injection. So it's just presentation, maybe the injection where it's injected, that's it. And it's just your clinic will advise you of which of these medications. And I think that's a great thing, that we have options and we maintain those options and remain flexible with that.
Perfect. Thank you so much. Yes, again, it's all about the options, and that's the flexibility that you have when you're going through a treatment. It's not rigid, and it's not one size fits all. And that's why not only your conversations here tonight, but your conversations with your clinic are very important, because they're doing everything they can to try to customize it for what you need and what you're going to be going through. And so that's, why we love doing this program every week, because it's another place to ask questions specifically that, suit what you need, and to augment those conversations that you're already having at the clinic. And speaking of those conversations, it does seem, Wanda, like we have come to the end of the Q&A. Nothing has come in yet. I will go take a check and see if there's any more questions. So in the meantime, again, I'll give everyone another 30 seconds or so. If you have any last questions, whether it's about the Gonal-F, the pen or the vial, or the Avidril, or just kind of something somewhere in the middle, feel free to jump in and ask those questions now. But if not, we will get ready to start wrapping it up for tonight.
Great. So I'm always wrapping this up with a little helpful hint beyond just the talk about medications. I am also a certified healing touch practitioner, which is a way of working with the energy systems of the body, the energy centers, connecting, opening, and balancing those energy centers. That is what healing touch involves. But last week when I did my talk as well, I brought a book up, and I'll just share it again. It's Louise Hay, You Can Heal Your Life. And it's really what I brought up about that was daily affirmations. Louise Hay was an inspirational teacher with over 30 years experience in personal growth and self-healing. That was what her little legacy was. She only passed away just in 2017 at the nice age of 92. So I think she lived a great life and practiced a lot of what she has written about. Daily affirmations are simple statements that describe a goal that is already complete in a completed state. And we already talked a lot about this tonight, which is kind of funny that I picked this before tonight's video. So it was meant to be, I guess, because a lot of it came about flexibility. And in one of her affirmations, she does kind of focus on the mind-body connection and how I want to equate this, what she talks about is the oak versus the willow. And sometimes we vacillate between being oak-like and willow-like. And what I mean by that is if you think of the word oak, I thought of it today. It's a very short word. It's kind of curt. It's kind of quick, word. So sometimes we're a little bit quick to react. We remain a little bit inflexible. And when we feel that in our bodies, it doesn't feel quite great. It feels a little stiff. When your body's stiff, you don't feel too great. Whereas with the willow, I think of the word willow and it's a little bit flowy, ease and gentle and softer. You kind of go with the flow. I feel myself moving when I say that. So the idea about that willow is, making our mind and our body be a little more like that willow, a little more flexible, a little more less rigid. So I think my key in saying that is, as you can see tonight with a lot of what we talked about in the videos, there's a way for us to be flexible, and these are challenging times. And I think it's real important that in this world of challenge and change, that we do what we can to remain a little bit more willow-like, because I think it can serve us better. When we're a little bit like that oak and we are in the midst of a storm and we're so rigid, we snap, and we snap at people that are really there for us, whether it be we just don't feel like it at that moment because we feel a little more inflexible. And we might snap at our significant other. We might snap at the nurse at the clinic, the doctor, the pharmacy, and it doesn't make us feel good to do that. So what I want to say about Louise Hay is she's all about affirmation. I gave one last week. I'm going to give you another one. I didn't write it down today, but I want you to think about the flexibility and state, my body is flexible and so are my thoughts. My body is flexible and so are my thoughts. And if you say it once a day, twice a day, those affirmations are just a great little tool to empower you in feeling really some sense of peace in doing your cycle and starting these medications and letting go and giving yourself a break where you need to give yourself a break. I really just want to remind everybody that I'm happy to have been here tonight with My Mandel's. I want you to know that you go to My Mandel's Pharmacist, mymandelsPharmacy.com/pharmacist to the virtual learning experience library with these videos, but also joining us every Monday at 7 p.m. with other nurses that are a part of this program. That's a great program for you and a great resource to help you feel that you are getting all that you can and all the information you can and soak it up so that you feel comfortable entering that fertility cycle. So remember, my body is flexible and so are my thoughts. Thank you.
Perfect. Thank you so much. And I did get a chance to I put that information into the chat as well, the name of the book, as well as the affirmation for today. So it's something great for people to take a look at. And if you're interested in investigating that book a little bit more, the name and the author Louise Hay is right there in the chat, so you can take a look. I definitely just want to say, as I always do, thank you so much, Wanda, for an amazing show and for all of your expertise and your time. You bring a very great spin on everything, and I think your knowledge is obvious, but your ability to answer all these great questions with the little anecdotes and all that it's amazing, and we appreciate it every single time. So thank you once again.
I'm being a willow.
I like it. You're great at it. You are high. As much as I would like to say, sometimes I'm an oak, but I would love to.
That's okay. I am too. We talked about that.
Exactly. that was a pregame conversation. Yes. Thank you, everybody out there who joined us via Zoom and Facebook Live. We really appreciate it. Thanks for all the great questions that everyone brought tonight. We hope you were able to learn something. That's our real goal here, is to make you feel comfortable and confident so that you are a pro today, so that time that you have to give that first shot, all of the jitters are gone, all the questions are gone, and you're just ready to go with the flow, be a willow, not an oak. Yeah. And that's really our goal with the whole program. I'm going to say that a lot now. I like it. It really is. Good work. So the one thing also we want to say is to not forget that all of these full virtual learning experiences, like this entire VLE that we did tonight, but also those individual product demonstrations that you mentioned earlier, Wanda, all those videos are available on demand, not only on our YouTube page and our Facebook page, but as you mentioned, the mymandelspharmacy.com/pharmacist. So if you want, you can go and watch the entire video again with all the Q&A. And so if there was a great question, we didn't say this earlier, but hopefully you weren't furiously writing down notes because you have the ability to go watch it on demand later. But if you also just want to watch, say, I'm about to give my Gonalef, pen shot for the first time tonight. I just want to watch that, couple minute video. I want to see that 5-10 minute video that walks me through that. You can check that out also. It's all separated out so you can look for whatever product you're looking for or the full VLEs. So that's a great way to be able to use this information again later on. Maybe you want to bring in your like a friend or a partner or somebody's going to help you with the shot, whatever that might be. They can watch the video as well with you, and so they can kind of get a chance to go through all those questions that you had tonight. So thank you again for that. And with all that being said, we are super excited and look forward to seeing everybody here again next Monday night at 7 p.m. for another great program. The number one most important thing we can say is please, 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 if you enjoyed the program tonight, please share it with anyone that you think can benefit from the program. And that is, could be a friend, it could be a family member, it could be a colleague, anything, anybody out there. That's the way that this word can get out about the program. Let people know if there's somebody else out there that's probably going through a similar situation and they can benefit from this program. And that's how we get more great questions that we can answer. So please go ahead and share. We appreciate that so much. Even if you're on Facebook, just share the link out to somebody and let them know, because there's somebody out there who feels just like you did before you learned about this program and they were looking for a place to find an answer, and you can be that catalyst to give them that answer. So thank you so much. Thank you, Wanda. Thank you everybody back home who's listening. One more time, I will say it, even though now we're about over a week out, but Happy New Year to everybody. Happy 2021. Happy New Year. It's going to be a great one. It's going to be a great one. Thank you so much, everybody. Have a great night.